Hi, this is me. It's really bright. The moon was back there. It's not there now. There's the sun. It's really bright. Sorry, that was definitely not a smooth transaction. I am going to get the back of this. Just a glare now. Put my glasses back on. The lights back on. I'm gonna see what this tea tastes like. It was kind of hot. I don't think I was drinking it. Hold on. It's pretty hot. I made this like 2 hours ago. Maybe 2.5 hours ago. It's so good. It's Rooibos, the powdery kind, which is kind of expensive. That comes in that can. I don't remember the brand. And then there's the regular, just red Rooibos, or the African bush tea. I don't know if they call it African or South African. It's pretty good. I alternate between that and raspberry leaf tea. I had some I ordered in, was it 2019 or early 2020? That was organic, and I had a pound of it. I feel like, I don't know, I feel like it lasted a year to buy it by the pound, and it probably didn't last a year. I don't know. And I needed to get, so it was loose leaf, so I needed to get a tea strainer, and I got a pretty big one. I don't have any of the little teacup, like I have some of the teacup ones. I had some, like you clamp it open, squeeze it open. Those hold a very tiny amount of tea. Sometimes I like those. Those were what I was using at first. I was using the tea balls. Those hold more at first, but the ones I had, it's like it was impossible to open them after like making the tea. It was really awkward to have your leaves stuck in there and not be able to use it. And then the chain, you had that chain with the little clasp on it. I don't know where you're supposed to clasp, but I feel like those would be all funky. And then the spoon thing, and then just the thing where you feel like literally you could put like 3/4 of a cup of leaves in there, and flowers or whatever, and roots. I have my friend was doing, when we lived with them, were they cooking the leaves in the kettle and then having some kind of filter to do the filter it as you're pouring it into the cup. Like maybe they had it on the cup or something, on the teacup. So I don't usually use a teacup. Teacups are pretty small. I usually use cups designed for coffee. I have some different teas. I have some detox teas. I have the smooth mood teas. I used to drink those more regularly. I don't drink those because it's hard to have the days off needed to, like, it's like my body, it's like I want a lot of water. I might want a little bit of fiber. I might want a lot of rest, and maybe get crampy and don't want to move, and then get up and move, and then you want to keep moving. So I've had those kind of situations where you feel good being close to home, or if you are out, close to the bathroom just in case, but if you are out, something like you're still semi-close to home, but you're out in nature, not necessarily shopping, or, I mean, you can think of going to Target or something, and walking, getting what you need, and being near a restroom, and being near your car. So that's something. I was gonna talk a little bit about the days off now as a so-called grown-up, and not working my self-employment as my income generating business for living expenses, and having the college days, there was the college days that turned into grad school / medical school days, and then there was the being on call 24/7 for births. So I would think about detoxing. I'm going to rewind a little bit. When I was on call for a birth, say they're due today, we would have been really hovering 2 weeks before today and 2 weeks after today, and that's more than 2 weeks, 2.5 weeks after today, 2.5 weeks before today, 34 weeks, 36 weeks. We would try to do the home visit, because you want to get there before, because going into labor 37, 38 weeks is not that unheard of. Something stinks over here. Good grief. What is up with... I want to ask someone back in time. I'm going to make a notebook of things I want to ask people back in time. What was it like? Did it stink? It's like, well, it does have that kind of fishy smell. This stuff is still left out, so I gotta take this stuff to the dump. Either come back and do the one dump tomorrow. Oh, I can't see anybody's parking passes here. There's one, there's two. I don't know what that guy's doing. Is this the state government one? Yeah, state government. Their trucks look the same as everyone else's. You gotta look at their license plate. I thought I gave this other guy a ticket the other day. He has a pass from... I swear I gave him... He has a pass from... last year or the year before or something. Let's see. I gotta pull up next to this electronics, and the dump that I'm near is closed. He's got a sticker on there now. Okay, good. Thank God. I do not want to have to issue anything. I don't even want to give a warning. Warnings aren't friendly though. Let me just park here, and I gotta get these electronics. Like, why didn't anyone else pick these up? I said I was gonna come back and get them, and then I went and did all their work far away, and I was like, oh, it's gotta be someone else. I know someone else would have got these computer monitors. They would have put them in the trash. They wouldn't have thought twice. They would have been like, oh, I'm gonna leave them, or oh, I'm not gonna think twice about it. You put them in the trash. You're supposed to put them in the electronics. So the dump I'm at, today's Thursday, they're open tomorrow and Saturday, closed today. So there's another one up the street. They sent me an email. I gotta check it now. I gotta do the address. It's in Graysonville. That's about, I'd say at least 20 minutes from here. When you do the home visit for birth, when I did a home visit, I would say we would do it as a team. The midwife, the naturopath midwife, and then so one naturopath midwife, me, 2 when I was a student, 3 whoever was on assist would do a home visit. Did they have more than one bathroom? Big question. Did they have more than one bathroom? Did they have one bathroom? Okay, take it easy on anything that's going to move your bowels. And that's what sucks about thinking about animals, even outside animals, like outside domestic animals. And sometimes it's unsanitary, but they can use the toilet when they need to. And humans, it's not like your body's just like, blurp, there you go, blurp, there you go, blurp, there you go. Like reading and hearing and seeing, like, just occurs at the time that it occurred. I can hear myself talking at the time that it occurred. I don't, like, for us, it's like we have to stop what we're doing and go control ourselves and find an area appropriate to relieve ourselves. And I feel like I have a lot of impactation in my bowels because of stuff getting putrid and hardened and just not flowing right from the time you're out of diapers, when they tell you, oh, you're potty trained, good job. And even in diapers, you're not like a wild animal where it's like the mother's cleaning up as the stuff's coming out. Someone's getting mad about the toilet talk. There's one of the first books I bought. The very first book I bought at a naturopathic school was at Bastille, and it was about your poop, and it had pictures and descriptions, and I thought it was very important because there's a lot of chronic disease. If you go into a city or even a small town, I don't know about small towns, but go into a city hospital that has inpatient beds and count how many floors are in that hospital. If OHSU, it's not even just that one building, it's multiple buildings. Count how many floors there are. Count how many are inpatient. Go up and down the halls. You probably can't do it. I did it when I was a volunteer. I could go up and down the halls, but get a map or ask somebody, hey, information. How many rooms do you have? I'm just curious. Or just in total, how many beds do you have in this building or in the whole complex? It's like, do you have 2,000 beds? You got cancer treatment, you got organ surgery, you got ICU, you got NICU, you got all these different things. Why are the people in there? Did somebody get shot? Maybe did somebody get a car accident? Maybe did somebody have cancer? Maybe did somebody not inpatient doing dialysis? Or maybe they're inpatient and we've had a lot of people that were inpatient and went and did dialysis. What could they have tried when they were 10? When they were born, when they were 25? That would have been preventative medicine that could have helped them decrease the risk of having the disease that they have that's chronic, and there's no turning back the clock. You can only step forward, move forward, change your lifestyle today, right now. What is the treatment plan? Can you live another day? Is it a miracle that you had a breast tumor removed, chemotherapy, radiation, change your diet, got rid of sugar, start eating fruits and vegetables, cut out wheat, ate very little meat? What if you did all that when you were a child? What if you were that kid that wore old clothes and had hippie parents and they had their own garden and chickens in the city, and people say, hey, farmer kid or whatever, and threw eggs at your house and you were eating? I seen this guy, he was a heavy drunk, and he's older, short, gray, white guy, light skin, blue eyes. He had the smoothest skin I had seen in a long time. He said, we grew up on a farm or whatever, or a small farm, and we ate our own food that we grew, and it was home cooked meals, and it was still cooked and processed and stuff was added to it, but it is what you put on it and into it. And I said, oh my God, I can kind of tell that you had that kind of diet. And a lot of people this guy's age had that kind of diet because there wasn't as many, frozen meals and fast food places. And it's just basically preservatives and additives. People say, I'm going to have so many preservatives, they won't need to embalm me. People make little jokes. And what is it when you're a volunteer in a hospital? I haven't been employee, so I can speak from volunteering. You go into a hospital and somebody's got lacerations or infected wounds or MRSA. What is it when somebody had a knee replacement or hip replacement surgery and they received an infection from the actual procedure that caused them to come back and forth or remain in the hospital for weeks and months at a time, from out of state or out of the city, or from out of town, out of state, out of the region, having to have their partner come up, and relatives trying to drive 3, 4, 7 hours to visit them once in a while, and they're back and they're depressed and they can't walk and they have an infection, someone's trying to open them up and they got to drain out this fluid, and The stuff that I changed my life when I was a kid, a younger kid, and then there's stuff that I changed my life when I was a teenager, a young adult, and there's stuff that I changed my life approximately age 27, going on 28, and then I kept changing my life. But life gets in the way of changing your life. Life gets in the way of saying, I'm going to grow this garden, I'm going to grow my own food, and I'm going to process it and pick it and preserve it and can it and dehydrate it and, make something and mix it up and put it in the freezer so I can have these ready-made, portions so that I won't have to pull out the whole season's worth of tomatoes or whatever. You have them in cans or containers, and you had sliced and cleaned and diced and everything. And what happens is, I have to be at work at 6:30 in the morning, and how am I supposed to do that? What I want to discuss also today, and I'm going to get more into it, is I am a licensed doctor. I'm also a ranger, which I'm going to ranger school in about 3 weeks. We're going to have it once every 2 months, all day. I'm going to look forward to doing that. I ought to order, speaking of getting food, I ought to order food to prepare for that. Look at this guy. Let's wave at this guy. Hi. I'm wanting to get more into first aid and emergency medicine. I did really well with first aid, emergency medicine, and minor surgery and IV therapy when I was in medical school. Also did really well in neurology and cardiovascular and pulmonary disease and homeopathy. So all that intense conventional stuff, and then homeopathy is something that's harder to explain. I think anything's hard to explain. Explain dreams. You can explain the heart, but what is the miracle behind the fact that you have electricity inside your body causing your heart to beat at a certain pace? And definitely from the time before you're even born until the minute you die. What? Explain that. Yeah, I can explain all of the impulses, the calcium channels, potassium. What does digitalis do to your heart? Or look that up. Digitalis. Some of those ones are really good for homeopathy for different things that are potent, seriously toxic. I'm not allowed to practice medicine as much as I want, and the medicine that I want to do and practice on people, they're not hiring me, so I want to be prepared to do anything. Come to my house, come to my door, come to my office. Come to my office, day or night. Well, I might not be there because I might be open the gate. Oops, I forgot. The gate's automated. My job has been automized. Uh-oh. I didn't mind getting here really early because it's before all the traffic gets here. So now you get here later and later, it's going to be more and more traffic. And my job, what I'm going to do is grab these things and get ready to go to the dump today. If not tomorrow, I can go tomorrow. I don't think it's going to rain. I was thinking someone would come and pick up these monitors. I had gotten some emergency supplies from Peppers. The squirrel's looking at me. Oh, Preppers for something. I didn't look to see who I was buying it from. But I had gotten some emergency kits, clots. I got one kit because it had the iodine wipes instead of the swabs. I have the swabs, but they're in my other office in a different state. I really would like that, but wound care, I'm not allowed to administer prescriptions in this state. So how could I do wound care? I wouldn't be able to because it would be well, who would want to have wound care done without anesthesia, local anesthesia, topical, not topical, but injection of lidocaine epinephrine. I don't do that on certain parts of the body, but I can do that in Oregon, so I'd have to travel. What I'm thinking now is if I'm going to be working under other people or working as a student under other people, just carry it in my med kit. I've gone to places where someone had forgot to refill their sutures or sterile tools got left or something. To have different sets of sterile tools. Like, oh, well, I'm your student, or I have it in my kit. You're licensed to use it here. If I'm not, well, it's all about saving somebody's life and healing them up if you had to give them sutures. So I figure that's the least I can do. Have some gauze, have some tape, have some instruments, and then have the syringes. So I can still do blood draws. I don't know the states that you can administer supplements and nutrients. And it didn't say anything about IV therapy, and that's kind of weirding me out. So I was thinking, dude, I am on B12, but I need a crash cart, which would be the epinephrine, which just, you can administer it. You can prescribe epinephrine, actually. You can prescribe EpiPens. So epinephrine would be, but not lidocaine. So oxygen and epinephrine, so you could do a crash cart. You should have a crash cart. Your patient can say, oh, I got these supplements before I came here from GNC, and I'm going to take it and show you the bottle. Or I took it right before I came in. They could have a reaction to it. Sure, call 911 if they go to anaphylaxis, but why not give them oxygen and then administer epinephrine if they don't already have an EpiPen or something? That's what I think. But I feel like it's the best interest of the patient under the care of a licensed practitioner who knows and has been trained and tested on all this stuff in order to get that license in the first place. And if you're a lay person and you do CPR, first aid, what is it, the Good Samaritan Act, you're going to perform CPR. It's like, oh, I just happen to have an oxygen tank in my purse. I just happen to have a clean, sterile mask and some tubing in my purse. Like, well, I don't know if that's crossing the line for Good Samaritan, but are you potentially saving some child's life? Maybe not. Maybe you're harming the public, but oh, is that a blue jay? It makes me smile with a little nub on the back of their heads. So last thing I want to say is education. So the stuff hit the fan. Would it be anarchy? Would it be martial law? Would it be too much control? Would they come and take any food? Did somebody see on the camera that you brought in, over the course of 3 months, big boxes of food and bags of rice and food delivered from the Grubhub, or the one that's not, fresh food, was it? Not cooked food, Instacart or whatever. Did they see, like for me, I had 2 boxes of Vitacost on it yesterday sitting on the back porch. Did they see, oh, they have Vitacost? It could be anything. It could be cleaning supplies. It could be toilet paper. It could be medicines, supplements, or food and water, or all the above, female products. Baby bottles and stuff. They sell cups like this on there, and candles and all kinds of stuff. Dish rags and stuff. Anything you bring in, it's going to say that you have money. Even if you put everything on a credit card and never pay it, they're going to say they got access to some money, which means they probably have more of it inside, which might be more than the person watching you. So be watch your back. Dr. Anderson, oh my gosh, what's his first name? He taught us for board exams during medical school. I took his class. I retook his classes over and over. I don't know why, but I learned some stuff. And I didn't know how well I did on the boards with the material, the way he presented it, but there's some little nuggets hidden in his teachings. I'm going to look and see if he has the IV therapy class. I'm just going to refresh myself. It's been a long time since I've been in med school. I did do in-person courses. We all had to do in-person courses, but we didn't all have to do IV shifts. I did at least 2 IV therapy shifts. One actual, it's everything you do is IV therapy. The second one was a person who liked doing IV therapy, and I got assigned to someone every week. And then 3, I did community clinic, I did regular B12 injections. I do that more than once, but I had a patient that would come about every week. I don't remember having a crash cart there. The main clinic I know had oxygen epinephrine, but this one had instead of a senior center, we had cabinets full of medicine. Who knows? So you don't have time to go through everything. You just want to stay focused on your patients and on your work. I had taken a CPR provider's class. I've taken a neonatal resuscitation program class. I've taken all those, and I'm taking other courses that I pay particularly free. So I'll have to pay for any IV therapy, probably minor surgery classes. I'm just going to take them as refreshers and maybe get a kit or make a kit where I can practice the sutures. And then refresh myself on the mixing of the IV therapy for future use or to work under somebody else. People were looking for that job here from a naturopath for IV therapy. So remind myself, because I don't have a hood in my clinic right now. I don't have a refrigerator right now. So the stuff that you can think about when you move into a new spot, a new office, or build an office, think of the budget to get these things to keep everything as sterile and clean as possible. And then I'll get back to you about some classes, but there's classes you can take for continuing education for healthcare providers, but there's classes you can take. You sign up for stuff and they might let anyone take like a first aid, or you just pay for it. Or so I just wanted to throw that out there as far as gaining knowledge in person would be good. And then the last thing would be figuring out the neighborhood courses that they have as far as being trained and doing the neighborhood. Oh shoot, this thing was still in drive. That's not good, guys. Brake was on. I'm gonna leave the camera on so you can see me in the back. Maybe put this stuff in the back and go in. I'm gonna tell you one thing, those things were way heavier than I expected them to be. We just had to get rid of one. My neighbors had a flat old monitor, and we just had to get rid of it for this last inspection. I don't even think I touched. I spin the corner. Do you ever have anything like that? It becomes just like wall art. Like for me, it's like, oh, I use this kitchen thing, I use this craft thing, I use this bathroom thing, shrimp poo, clothing. Then there's those things that have been in the same spot or moved 2 or 3 times over the course of like 7 years, and you're like, I have not used that. So you can share it. Bye, guys.